Okay, now we move on to a mother and a daughter team, and I'm going to ask the daughter, Veronica, to begin. All right?
Thank you. My name is Veronica Dunlop. I'm 17 years old, and I have complex regional pain syndrome. For me, this means that my right leg hurts all the time, from my ankle to my hip. On most days, I rate my pain at an 8 out of a maximum of 10. But if I increase my physical activity beyond a bare minimum, the pain escalates to a 9 or a 10. Even so, sometimes I can't resist increasing my physical activity. For instance, one Saturday night a couple of weeks ago, my friends wanted me to go to Fear Fest with them. This is a Halloween event at Canada's Wonderland where monsters pop out and scare you when you least expect it. I knew beforehand that this would be too much walking for me. But one of my best friends, Carly, was working as a monster, and we all wanted to go see her. So I decided to risk it. It was a big mistake. Not only was I terrified all night, but by the next morning the pain was overwhelming. It lasted at a 9 out of 10 for 6 days. On Monday, I went to school, but left after an hour because I couldn't stop crying. Tuesday, I went, but I learned nothing. And by Wednesday, I was so exhausted that I only stayed for 15 minutes. I missed a big English test and Spirit Day at my school, which I really would have liked to attend. I injured my ankle for the first time when I was 9. I tripped while running on some play equipment at recess. I knew immediately that I had broken a bone because I heard it snap. That day, April 23rd, 2003, was the last day that I was pain-free. Now I'd like to tell you about how hard it was for me to get treatment. For the first couple months after my cast was off, I didn't worry too much about the pain. I assumed that it would go away sooner or later. My doctor thought that the lingering pain was due to weakness. I did have my cast on for longer than usual because of the SARS outbreak. But instead of gradually getting better, my pain got worse. I had been very active in gymnastics and was competing at a provincial level. But the pain made training more and more difficult and then finally impossible. I had to give up gymnastics, which meant giving up my teammates, who were also my best friends, and transfer to a non-sport school. That was very difficult for me, and I was really sad for almost a year. Unfortunately, giving up gymnastics didn't make my pain any better. My mom and I went from doctor to doctor trying to find someone who could help me. I saw 4 orthopedic surgeons and 3 sports doctors. I had x-rays, MRIs, bone scans, and ultrasounds. The doctors told me that there was nothing wrong with me and that I just had to strengthen my ankle. I went to physiotherapy 5 times a week, but the pain continued to worsen and grow. It moved from my ankle into my knee and then later to my hip. I was finally referred to the pain clinic at the Hospital for Sick Children, where I received my diagnosis of CRPS. I wish I could say that I was successful at the pain clinic, but I wasn't. Over 3 years, I tried many different pain-relieving drugs: amitriptyline, gabapentin, nortriptyline, Lyrica, etc. Unfortunately, I suffered all of the side effects without any of the benefits. I feel quite resentful about this now because I have since learned that there aren't any studies that prove that these drugs are effective for children or teenagers with neuropathic pain. I feel like I was an experiment, a failed experiment. Now I'd like to tell you about how my pain has affected me. One of the most difficult parts of having CRPS is dealing with school. When I'm at an 8 out of 10 on my pain scale, I can actively participate in class. But when I'm at a 9 or a 10, learning is very difficult for several reasons. First of all, I don't get any sleep, so I can't think or handle stress very well. Second of all, the pain itself makes it difficult for me to remember or concentrate in class. And thirdly, since I'm not confident that I know what's going on, I don't participate in class. I've had to adjust my goals. Rather than focusing on doing well, I focus on simply staying at school. Over the years, many of my teachers have been very compassionate, but some have not. I have explained to them what the pain team has told me, that I have to come to school every day regardless of the pain. One day, following the team's advice, I went into math class with my pain at a 9.5. We had a big test that day, and of course, I bombed it. I knew the material, but I couldn't concentrate because I was focusing so hard on not screaming out loud. After the test, I appealed to my teacher and to my vice principal and asked them to discard the test because it didn't represent what I knew. My vice principal said, "It represents what you knew that day," and he insisted that my failing mark count. That was one of my saddest days as a patient with CRPS. I had worked hard and maintained an 80 in math up until that point, but that test brought my mark down to a 60. I was very sad for several months. I had no reason to work at all. I wasn't motivated. But then I realized I wasn't going to university unless I changed my plan. So when this new school year started, I made a brochure that described my condition and how it affected my learning. I handed it out to all my teachers, and together we established a plan for rescheduling tests beforehand when my pain level is high. So far it's working. I'm doing much better academically this year. Another thing that is very difficult for me is that I can't do lots of things with my friends. This really upsets me. As an example, one day last week, all the student leaders at my school were invited to attend a day-long leadership session at a farm. My friend and I are co-presidents of our school's social justice group, so we looked forward to a fun day off school. But I learned that there would be team competitions at the farm. I'd have to sit out because I can't run, I can't jump, I can't even hurry. I also knew that after a busy day at the farm, I would really suffer for several days and nights. With English and math midterms approaching and a big music project due, I couldn't risk it. So I skipped the leadership session. This type of thing happens to me a lot. A lot of the things that regular teenagers do, like playing basketball or dancing or going shopping, are things that I can't do without making my pain worse. I do a lot of sitting out. Today, the only thing that helps me relieve my pain at all is acupuncture. I go once a week, and although my pain is worse for the following 24 hours, it then improves to about a 7.5 for a few days. Luckily, though, I have qualified for an intensive rehabilitation program at the Children's Hospital of Philadelphia. The doctor there, Dr. Sherry, has a 92% success rate with patients with my condition. I'm currently waitlisted, but I expect to spend a month in the program before next summer. Finally, I'd like to suggest some things that the Ontario government can do to help people like me. First, educate the doctors about CRPS. After all, I spent the first 4 years after my injury listening to experts tell me that there was nothing wrong with me. Second, I tell the government to establish an intensive rehab program like Dr. Sherry's. I know it's expensive. We've been quoted $53,000 for my treatment. But surely 7 years worth of appointments with specialists, plus many x-rays, ultrasounds, MRIs, and bone scans cost even more. My greatest wish is that when I return from Philadelphia, I'm a normal teenager. When I was suffering in those days after FearFest, I kept thinking to myself, this is the last year. This is the last October that I'm going to hurt like this. Who knows? Next year, if you go to FearFest, the two scary monsters that jump at you might be Carly and me. Beware, my ankle is going to be so strong that I might chase you right out of the park.
Thank you, Veronica.